for you, including superficial fungal infection and sarcophytes fungi. At first, we have automycology. The causative agent for this disease are more yeast and dermatophytes. Dermatophytes can occur that patient that they have a dermatophytosis in some part of body, and after itching, the dermatophytes agent can transfer to the air and occur automycosis with dermatophytes agent. But the common causative for this disease are Aspergillus species, especially Aspergillus niger. In this slide, you can see three images of Aspergillus. In the right side, you can see the microscopic electro-microscopic view of Aspergillus niger. In the middle, you can see the detail of Aspergillus. In Aspergillus, we have a septate hypha, and we have a long hypha that is called conidioform. This is conidioform. The middle cell under the conidioform, we call it foot cell, and the top of the conidioform, we have an erased part that is named vesicle. And around of the vesicle, we have a erased part as a base like that we call it stigma or filial. And you can see the conidia, spherical conidia that attach to filial or stigma. And in the left side, you can see the cross-section tissue of automycosis. That in cross-section tissue, you can see the umbrella shape or sunflower shape in cross-section tissue in patients that they have an internal automycosis. And in this slide, you can see the dichotomous hypha. Dichotomous hypha means the hypha that two branches of hypha that attach together, and dichotomous hypha we have seen in patients that they have an immunodeficiency. And if you see one of dichotomous hypha, you should diagnose that patient have an immunodeficiency and invasive aspergillosis. Another fungal infection is tinea versicolor. This disease in a patient with dark lesion, with dark skin, we have a light lesion. And in patients with light skin, we have a dark lesion. The causative agent for this infection is Malassezia. The group of Malassezia, and the best method for diagnosing this infection is a Scotch tape, because a Scotch tape, the best method for collect the scale on the skin. And you can see three images of direct examination of Malassezia. In the right, you can see the direct examination of this infection of this fungi without any coloring. We don't have any staining in this slide, in this image. But in another one, in the middle, we have a direct examination of Malassezia that is stained with methylene blue, and in the right, we have a direct examination of Malassezia that is stained with Gamesa. In this infection, in direct examination, we have a grape-form cluster of Blastoconidia and curved or thick fragmented hypha. Generally, we said this view is very similar to
We wasn't
yes, spike. And this video is very special for diagnosis of Malassezia ortina versicolare. Malassezia can causative of another fungal infection that we call it dandruff or only scalp scale. But in this infection, we don't have any hypha, and we just see oval shape belastoconidia like this. They are oval shape or button form. And you know that Malassezia is a lipophilic yeast. And now I'll talk about saprophytes fungi. Previously I talked about aspergillus, that I said aspergillus have a septate hypha, and they have a conidiophore vesicle, phyolite or sterigma, and the top of phyolite and sterigma we have a conidia. Like this you can see three images of aspergillus. Another saprophytes fungi is penicillium. Penicillium may be similar to aspergillus, but they don't have a vesicle. If you see and more attention, you see they have a conidiophore and the phyolite or sterigma directly attached to the conidiophore, and we don't have any vesicle. And the top of the phyolite or sterigma, you can see the conidia that attach to phyolite or sterigma. And in this slide, you can see three images of penicillium. The meaning of penicillium is broom, because in direct examination you can see the broom shape or fork shape. And if you more attention, the penicillium is very fragile and very smaller, and they are very thin compared with Aspergillus niger. If you see the broom shape of saprophytes fungi under the microscope, you should diagnose the penicillium. Another saprophytes fungi that may be similar to penicillium is Scopolariopsis. Scopolariopsis is very similar to penicillium, but the conidia is very large and lemon-shaped, and around of the conidia you can see the erased part. If you change the mesophone in the microscope and more attention, you can see the erased part around the conidia. And sometimes when we have a multiple branch of Scopolariopsis, maybe it is similar to penicillium, but they are sharper than penicillium. And the diagnostic key for this infection is the conidia, because the conidia is very large and lemon-shaped. And in this slide you can see two images of Scopolariopsis. At the right you can see the electron microscopic view of this infection, and in the left you can see the Scopolariopsis that is stained with Gelsa. Another saprophytes fungi is Fusarium. Fusarium is common causative agent for keratomycosis. In direct examination, in microscopic view, you can see the macroconidia. The macroconidia for this infection is very special because they are fusiform or banana shaped. And in this image you can see the fusiform or banana shape of these fungi in common causes of keratomycosis, especially Fusarium solani. Another type of saprophytic fungi, the fungi that they have a no separate hypha. And two special species of these fungi are mucor and rhizopus. They are very similar together, but in rhizopus we have a rhizoid, and in mucor we don't have any rhizoid. Mucor and rhizopus is the fungi that they have no separate hypha, and instead of conidiophore, we have a sporangiophore. And the top of the sporangiophore, instead of vesicle, we have a columella. And around of the columella, we have a sac that we call it sporangium. And in the sporangium, we have a several conidia that is named sporangiospore, like that. And they are very similar together in mucor and in rhizopus. But under the microscope, in microscopic view, under the microscope, if under the sporangiophore, see the rhizoid, you identify as a rhizopus, like this. Okay? And if you don't see any rhizoid, you identify just as a mucor. In mucor we don't see any rhizoid. And now we talk about two Dimatoaceous hypha. Do you know Dimatoaceous fungi? What is Dimatoaceous fungi? The fungi that they have a melanin in their cell wall, and in the microscopic view, without any staining, we have a color band in the conidia and in the hypha. Without any staining, we have a brown color. One of them is a cladosporium. That direct examination and microscopic view of this fungi is very similar to tree and fragmented branch, like this. And the conidia is very similar to the leaf. This is another image of cladosporium that is tree, and that the view of this fungi is similar to the tree and leaf. And the last, we have a alternaria. Alternaria is another fungi that they have a melanin in their cell wall, and the special key for diagnose this fungi, their conidia, because the conidia is very similar to the grenade or blackberry. And if you see one of these fungi under the microscope, you should diagnose